Welcome to the Womb Wellness Summit, ladies. We are here today with a very special guest to talk about all about the pelvic floor. And I know that in this summit, in this series, it's going to come up once or twice. It may have come up already. It may be coming up later. But this is an interview that you're going to want to listen to because it's going to come in handy a lot. So Katie and I were talking about the people that we had to have involved in the summit to have a really full picture of womb wellness. And one of the people that we were like, we've got to have a pelvic floor expert, which of course Katie was like, I immediately know who it's going to be. So I'm going to toss it to Katie so that she can tell you that story. But just know that this is going to be one of those videos that you might want to, purchase the summit for. I'm just saying. Okay, to Katie.
Thank you for introducing and welcoming everyone tonight. I first learned about pelvic floor probably 2.5 years ago after a friend of mine had her first baby. And she was telling me that she got injured and she couldn't walk. And I was like, oh my God, that can happen? And she was like, I had no idea. They sent her home. They didn't, they said that she was fine. She just had a baby, not to worry about it. And then eventually she found someone to come to her home to help her. And that was my introduction to the pelvic floor. And this wonderful lady now introduced me to Marcy. She and I met. We had lunch together. We totally hit it off. I love the way that she brings humor into talking about pelvic floor, all the dysfunction that can happen, and in a way that makes you feel so comfortable that you're willing to spill all your guts and share with her what is really going on. Because I think that's the most important part of this conversation tonight, is to really know that there are a lot of things that are common, but it doesn't mean that it has to be normal. And Marcy really shared that with me when we met in person before we hit record tonight. And I'm really honored that she joined us this evening to give us a really complete picture of this very important part of our body. So welcome, Marcy. Thank you so much for being here.
Yeah, thank you so much for the invitation. I'm so excited to talk shop with you guys. I mean, I can do it all the time. I love it.
Awesome. Well, I guess we'll just get started and jump in. How did you get into this specialty? Because it's a very specialty type of physical therapy.
Yeah, it is. It's a great question. And my story is kind of similar to yours. So, so went to PT school. I got my doctorate at University of Southern California. And the first year of PT school was a ton of anatomy. And the anatomy professor was first year, first semester, she introduced the pelvic floor kind of at the end of the course. And she used the example of a woman who had a pretty significant injury during childbirth and then was experiencing some pain and bladder dysfunction afterwards. And so my takeaway from that was wait, you tear during delivery? What are you talking about? It totally blew my mind. I was just naive, early 20s, what? So then I just started to do a ton of research and found that it's a completely underserved population of men and women who are experiencing pelvic floor dysfunction, which can manifest as all sorts of issues. We can talk about later, but mainly we see a lot of pregnancy and postpartum, but it affects people kind of all through the lifespan. And I just wanted to do it. I felt like it was kind of my calling, as cheesy as that sounds. And it doesn't bother me working in this area vaginally and rectally. I don't have any problem doing it. I mean, muscles are muscles to me. And I like the connection that I get with my patients. We get to spend a lot of time together one-on-one for an hour.
Mm-hmm.
And I just feel like that really kind of fit my personality a little bit better. So I just kind of steered myself in that direction. I did as many courses as I could take as a student. I did my last long-term rotation in pelvic floor health in Pasadena. And then I went right into residency after I did my doctorate. So I spent a year specializing in pelvic floor dysfunction, pregnancy, postpartum, chronic pelvic pain, sexual dysfunction, breast cancer rehab, female athlete, post-prostatectomy, male pelvic pain, basically everything breastbone down and knees up is kind of what I spent a year like just immersing myself in. And I learned a ton. And then I went right into private practice after that. So I worked for 4 years in the Bay Area for a private practice. I managed and ran their second branch. And then my husband and I moved to Portland and I worked there for 4 years, had my two babies there, took some time off. And then we moved back down to LA and then just this year. And then I opened my clinic. I hung my shingle. So I have always done vaginal and pelvic floor work. I mean, I like could technically treat a shoulder. Probably wouldn't be the best person, but like, give me like pelvic pain and like an itchy labia, and I'm like, yes, like let's do it. But I don't know, like an ankle, I might need to do a little refresher course. But yeah, so that's kind of what I've always done, and I love it. And I just like love vaginas. What can I say?
Awesome. Well, we love that you're here sharing that with us.
You're in the right place.
Yeah, I know. It's like I love all this like vagina empowerment. It makes me so happy.
Yeah, I love it. One question that I think we should just lay the groundwork, so to speak. What is the pelvic floor for everyone listening?
Yeah, so the pelvic floor is a dynamic group of muscles. So you've heard the term like do a Kegel before, or you might have heard the term levator ani, which is kind of like the term for like the group of muscles. But basically, and I have my model, I'll show you in just a second. But basically, the pelvic floor is a basket of muscles. It's like a hammock or a sling, and it goes front to back and side to side at the bottom of our pelvis. So if you look at my model here, right here is the pelvis. Okay. I'm going to like peek over her.
Love it.
This is the pubic bone, which is at the front. So here's our side view. Back here is the sacrum and tailbone. And then this is our lumbar spine. So I'm going to just like point her up. So all of this red stuff is pelvic floor muscle. Okay. So if you see, it goes from front to back and side to side. And then if you look inside the pelvic bowl, that's kind of the orientation of the structures. Okay. So this is really the only type of skeletal muscle, which is the same stuff as like our bicep or our neck or our quad, that lies in this plane, which means it goes across the body and front and back. So one of the main functions of the pelvic floor is supportive because everything's in here. Bladder, rectum, uterus, vagina, baby, all of our guts, us, gravity. So it's basically the floor of our core. Okay. It's kind of like a cheesy saying, but it's the floor of our. So when people talk about doing core exercises or really working your core, you have to incorporate the pelvic floor muscles into that, because without them working optimally, whatever is happening in the abdomen or the low back is not gonna work from a biomechanical standpoint, because those pelvic floor muscles have to be contracting with them, and they have to be relaxing appropriately, and they need to be coming on and turning off and all that good stuff. So the main function is supportive. The second function is continence. So within the pelvic floor muscles, we have our sphincters, and that's what close to keep us dry, to keep urine in the bladder, to keep stool and gas in the rectum. And then, we get the urge to go to the bathroom. We go to the bathroom. We sit down. We take our pants off. We say like, okay, I'm going to pee now. The bladder squeezes urine out and the pelvic floor muscles relax. Same with stool. So sometimes what we see is that whole kind of coordination is dysfunctional, and the muscles, instead of relaxing, are staying tight. And that can lead to a lot of issues like constipation or urinary frequency or weak stream, or feeling like you're not getting all your pee out, or maybe like frequent UTIs. And we can talk about that later, but the muscles have to be able to be functional in many different states, strong and contracted, and lengthened and relaxed. It's not all about like getting a really tight vagina. Like that's not functional or what we want. So continence is the second main function. And then the third function is sexual, because these muscles, there's layers. This first layer here attaches to the side of the clitoris, right there, our favorite first little And then these muscles go around the opening to the vagina, and they need to lengthen in order to allow penetration. So that either can be a penis, a tampon, a speculum, a dildo, whatever you want. How's it going there? So these muscles need to let go in order to allow that to happen. And orgasm is a rhythmic contraction of muscle. So this first layer here that attaches to the clitoris needs to be able to do that in order to have an orgasm and relax afterwards.
Mm.
So there's like kind of a whole, subset of people, men and women, who can have sexual dysfunction either with pain or difficulty with orgasm or lack of sensitivity or too much sensitivity, which can be problematic. And that can be a neuromuscular issue with the pelvic floor or the surrounding nerves and connective tissue. So those are the three kind of like big ones: supportive, continence, and sexual.
Wow. So it's very important.
Yeah.
Yeah.
She's a big
like
one.
Yeah.
Well, why I say that is because it's so important, yet I didn't know about it until 2 years ago.
Yeah. And the thing that's like, I hear it all the time. I mean, everybody's like, okay, what do you do? What is that? And then secondly, like when people come into the clinic, they're like, what is happening down there? Like what? And I think part of it is that, we don't see these muscles like we see, my gigantic bicep right here. Like we don't see these biceps and we're like, oh my God, that's like my bicep. Like I know how to contract that and I know how to let that go and I know how to move my arm. The pelvic floor is like super in like a weird spot and we don't see it. And all we really know is what Cosmo tells us or what we hear about like, having a tight vagina and doing like Kegels all the time, or like a doctor might say, or another provider might say after you have a baby, like, oh, do, 100 Kegels a day. And you're like, okay. But it's like, how do you know if you're contracting them appropriately? How do you know if you're relaxing them appropriately? We don't go to the gym and do 100 bicep curls every day. Why would we do 100 Kegels every day with no instruction or guidance or know what your baseline strength is? So with the muscles being made up of skeletal muscle, they're at the same like risk for injury, overuse, tightness, fatigue as any other skeletal muscle. So like we can have shin splints in our vagina. So it's like the same, so many things can happen. But it manifests differently. It manifests like bowel and bladder dysfunction and abdominal pain and tailbone pain and incontinence and that sort of thing. It's not like, oh, I have pain like right on my pinky finger. It's like kind of a little bit more diffuse and kind of harder to pinpoint.
Yeah.
Right. And since so many people don't even know that there's a muscle there, that's not even a thought that would occur.
No, or that like they have control over it, or that they can do something to change the way it's functioning.
Yeah.
Because we don't like think about that.
Right.
Yeah.
Yes, exactly.
Yeah.
And one of the things you said earlier was that when you think about working out your core, you don't think about your pelvic floor. And when you think about working out your core, you think crunches or sit-ups or Pilates or something that's
planks.
Planks, yoga. I mean, all of these things, but those aren't really the things that address the pelvic floor.
Correct. In a perfect world. So yeah.
Fair enough.
I wouldn't have a job. So yes. So the pelvic floor should be working synergistically with some of the abdominal muscles, which means that they should be coming on and off with contraction of those muscles. And a lot of times, like people have a difficult time engaging the correct abdominal muscles when you're doing these kind of core exercises just by themselves. And then like adding the pelvic floor into that is also very challenging from like a motor control standpoint. Not necessarily that there's like weakness, like their muscles might not be weak, but it's more of like a motor control kind of proprioceptive, like I can't figure out how to link them. And this could be why, they have, I don't know, for example, back pain that's not getting better, but they've been doing core exercises and Pilates for years and years and years. Like maybe the pelvic floor isn't like doing what it should be doing to help support the lumbar spine and the sacroiliac joints. And then when we do like a lot of rectus abdominis, which is your 6-pack abs, just the kind of isolated rectus work, like crunches and that sort of thing, sometimes like we can overdo it with those muscles, and then the pelvic floor could take over because we're not using our stabilizers the right way, and then we start to get like lots of tightness in there, because the pelvic floor is like, I'm the only thing that's holding us together. Like I can't. I'm doing so much, because like the deep abdominals, the transverse, the ones that should be supporting us, like they contract in like a corset, aren't doing what they should be doing. And so it's just like rectus, 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 which is crunches and that sort of thing. And so we're not getting that stabilization that we need. And then sometimes the pelvic floor just like goes bananas.
No, that's a really good description.
I mean, just like any other muscle.
Yeah. Like if you only worked your bicep, right?
Yes.
Every single day, right?
Yeah.
Then you would have a huge right bicep and then nothing on your left arm.
Yeah. And like never learn to relax it.
Yeah.
So like you're here all the time, and then you're like trying to let go and you can't. And it's like, this is not functional. Like you can't do anything with this arm. It's like, maybe brush your teeth, but like that's, like you can't live your life that way. So the same thing with the pelvic floor. Like you can't walk around all day with like a super tight pelvic floor, because it's supposed to lengthen, and it's supposed to contract, and it's supposed to hold and release. And it has different fibers in there. It has sprinting fibers and marathon fibers, just like any other muscle. So both of those have to be working together. Those marathoners have to be on to hold you nice and supported and keep you continent, like as the bladder is filling, right? And then on the way to the bathroom. And then the sprinters have to be on when you like laugh, cough, or sneeze, and you need that like quick kind of support against the urethra or the bladder. So it's not just like one type of exercise, like one size fits all, one cookie cutter approach. It's like really super dependent on how it's functioning in your body.
Yeah. So what about some common things that you hear a lot of women say? Like I overhear often.
Yeah.
Whenever I sneeze, I pee a little.
Yeah, it's like peasing or something. That's like the new mat. Like,
oh, is it?
Yeah, it's like ridiculous.
I can't keep up with that.
I know. Yeah, I'm like not cool enough to like figure that out.
Yeah. But like, what are some things that like maybe many of us are walking around with every day, and we're just like, oh, that's happened my whole life, or whether you've had a baby or not? Yeah,
that's a great question. So I definitely think so the stress incontinence is very common. So 1 in 3 women are the statistics for that. So that's where you lose urine. So 1 in 3, that's one of us, right?
Yeah.
Me. So had 2 babies. So 1 in 3 have some sort of stress incontinence. So that's where you're losing urine with increases in abdominal pressure. So this might be laugh, cough, sneeze, lifting, any sort of dynamic activity, running, jumping, trampolining, that sort of thing. And it can be for women who haven't been pregnant or haven't had babies either. I have a lot of very fit women who are leaking urine during these activities. CrossFit, a lot of sometimes like the double unders, CrossFit kind of came out with this thing a while ago, or someone did, about like how it's normal to be leaking urine during double unders in CrossFit. And it's like, that's not normal. Like you should not be doing that. And so, that is not maybe necessarily so much that the pelvic floor is weak or stretched out in those women, but perhaps it's a little bit too tight and not functioning the way that it should because the muscles are too short, or not coordinating the way that they should be with the abdomen. So it's not just moms or pregnancy. It can be women in all walks of life. There was a study that came out. I can't quite remember the statistics right now, but it actually was like very, pretty shocking about jumping female athletes, and how these are female athletes that hadn't had babies and hadn't been pregnant. And the occurrence of stress incontinence in that population was like significantly high. I mean, it was like 40% in the study or something like that. Wow. I mean, I can't quite remember it exactly, but it was something that I was like, oh my God, like that's a lot of incontinence. So, quite a few women come to me for that. And then this notion of, like common versus normal, just because like 1 in 3 have it doesn't mean that it's normal or that the system is like functioning the way that it should. Like something is failing in the system, whether it's the abdomen or, it's something anatomical or the pelvic floor or what. Something isn't working if it's not supporting you during these activities. So I think that's a question that I get a lot. Is this common? Am I the only one in the world that's doing this? Nobody's talking about it, or am I like, I don't want to go. It happens a lot with new moms. Like, I don't want to go out because I'm afraid I'm going to sneeze and, pee my pants. And then I have this new baby and like, what do I do if I'm at the grocery store? And I mean, it's very functionally debilitating to have pelvic floor dysfunction. And not just from like a leaking standpoint, but also from like a pain standpoint or a urinary frequency standpoint. I mean, I see, women and men who, are, like going to the bathroom every 30 minutes, or they're not sleeping through the night because they have to pee 8 times, or their frequency is like so out of control that they're, like they can't leave or go live life because they need to be by bathroom to try to avoid every, 20 minutes sort of thing. So, so I think the question, one of the questions I get a lot is like, am I the only one out there? Like, what does this mean? What is happening? And oftentimes there's not like a diagnosis necessarily, like a kidney stone or something. It's like all these tests are clear, they've been worked up to the moon and back, bladder is fine, there's nothing big bad and scary in there, and then they're like at a loss. They're just like, what is happening to my body? And then that's when like they usually kind of find pelvic floor PT and they're like, well, I'm trying this, like what is happening? So yeah, so that one, common versus normal, and then like, am I the only one?
Yeah. Which can be very unnerving, right? If you don't know that this is common and 1 in 3, just knowing that for anyone that's listening, it's like, okay, well now I know that I'm not the only one, and now I know who can actually help me.
Yeah, and like what to look for, and kind of like who, assembling your village, assembling your team.
Yeah.
Something that comes up a lot for me and my clients is sex, painful sex.
Yeah.
That's one that comes up a lot. And I think for women, it's not something that we think about being a pelvic floor issue. We just think we're doing something wrong. And that's just a terrible way to think about sex. So
yes.
What are some of the things that you see as far as like the pelvic floor and painful sex going together?
Totally. So I see a lot of it for women who have not had children. So not like a trauma issue or breastfeeding issue. We'll talk about that in a second, but like just kind of generally pain with intercourse, pain with insertion. These can be women who like maybe never have been able to tolerate a tampon, or had really difficult time tolerating a speculum exam at the OBGYN. Maybe they can tolerate a finger, maybe nothing. There are some cases, it's called vaginismus, where you can't, like, it's a spasm of the pelvic floor muscles that basically like shut down the vaginal canal, and like you can't get anything in there. And I've seen quite a few women who have been unable to consummate their marriages, and it's not from like an anatomical issue. It's not like an imperforate hymen. There's like nothing, like they're bleeding out of their vagina, like everything's fine from like an anatomical standpoint, but their pelvic floor is just so restricted, and maybe their introitus, which is the vaginal opening, is maybe a little bit smaller. So it's like they can't get anything in. So that can be like definitely a muscle issue. Sometimes people tell me that they feel like they can get in a little bit, and then it's like something is stopping them, like it's hitting a wall. And that's kind of like textbook pelvic floor hypertonicity, this like hitting a wall sensation. Because when those muscles become short or restricted, the only place really they can go in the vaginal canal is in and up. And then that closes it. So like when something's trying to get in, the muscles are taking up space. And so tolerating penetration or having pain that way is not going to be helpful. not going to be pleasurable or just from like a mechanical standpoint. So I see that a lot. And we just work on the muscles just like we work on any muscle. Manual therapy, I get them working at home with dilators. I give them specific exercises to release the pelvic floor. No Kegels because their muscles are already contracted. We work on lengthening, diaphragmatic breathing, mindfulness, like all sorts of stuff. How to use lube the right way, correct way, I should say. Good lube, like.
Let's talk about that because
Yes. My God.
You and I talked about that at lunch and I was like, tell me more about this dropper.
The dropper.
Since we've already talked about sex today, let's keep it going.
Yes, keep going. First of all, I would say that the time in our life is now to spend money on lube. Like, do not buy cheap CVS or lube from the drugstore. We buy good lube. And I like a lot of it. I think there's no issue with like copious amounts of lube, but kind of like trick of the trade, kind of like trade secret for pelvic floor PT is I have patients put it inside like a vitamin dropper, like an infant syringe or vitamin dropper, like not the ones with the needle, but like an oral syringe is very small. And if they can tolerate that inside the vagina, I have them like suck lube up into the vitamin dropper, insert it into the vagina, and then squirt it in. So it coats the inside of the vaginal canal. Lube is designed to sit on top of the surfaces of the tissue and make it like an ice skating rink, right? Like slippery. So if we only put it on the outside of us, on the outside of the vaginal canal and on our partners or whatever is going into the vaginal area, it can like come off, right? And like come off to the sides and like dry out. So it doesn't necessarily like go in far enough into the vaginal canal to get like full penetration or full insertion. So sometimes just adding a little bit more lube in there is like makes a world of difference. What?
Super clever.
I know, right?
Really. When she told me that, I was like, oh,
like,
I know.
hashtag life hack.
I know. I was like, I need to like patent like some sort of like lube delivery. But yeah, it's like it's helped so much, especially for like my postpartum moms who are having pain with intercourse because of breastfeeding and lack of estrogen at the tissue. Like using good lube higher up and at the opening is so important. And there's nothing wrong with that. Some people are like, oh my God, I never had to use lube before. Like, what does this mean? And it's like, it's fine. Just use lube. Like,
lube is our friend.
Ain't no shame. Yeah. Ain't no shame. Doesn't mean you're like less sexy. It just means that like your tissues need a little help.
Yeah.
And it's amazing. Like use lube. Love it.
Well, what kind of lube do you recommend? Since most people probably get it at CVS or Walgreens.
Yeah, no So in my clinic, I use something called Slippery Stuff, which is kind of like the pelvic floor PT's lube. If you want to be like more natural, people will use like olive oil or coconut oil. That's fine. Not compatible with condoms though. Those oils are not. So if you are using condoms, like make sure that you pick something that is compatible with that. And then there's a couple other brands out there. Uber Lube is supposed to be really good. I haven't used it. I have a couple patients who really like it. And then there's something else called Pink, I think, is another brand that some of my patients really like. And then there's some like more kind of natural ones. Usually if you go to a high quality adult store, like a women's kind of like posh adult store, they'll have sample packets of things and you can look at the ingredients and kind of see what you want to use. But yeah, Slippery Stuff is kind of my go-to.
Okay.
It's a really popular one.
Yeah, super popular and like very good for sensitive skin because I see a lot of people who have like nerve issues and like vulvar pain and like labial pain and clitoral pain, and sometimes lube can be very irritating to the tissue. And I have found with my usage of Slippery Stuff that it's non-irritating and people tolerate it pretty well, and it doesn't dry sticky, which is like nice. Yeah,
score.
Yeah.
I can't let you go without asking you to talk to us about Kegels because you've mentioned them a bunch, and also we know that there's a wrong way and that it's probably not what most of us think it is. So you have to give us the inside scoop on the Kegels.
How much time do we have? Okay. So here's my deal with the Kegel. Like, I love it. The Kegel is fine. Okay. It's basically a shortening contraction of the pelvic floor muscles, and it's functional. It's what the muscles should be doing when they're supporting us, turning on to keep us continent, contracting. That's what should happen. So the Kegel, it's like the cueing is, think about you're squeezing your vaginal muscles like you're trying to stop urine or gas. Another one that I like to use is like you're trying to pick up a blueberry with your vagina, like pick it up, like lift it towards your head. Like the muscles need to come in and up, right? Because that's kind of right. Like a good friend of mine uses like you're sucking up a smoothie through a straw.
Oh,
Your vagina like this up. So that's what they should be doing. Okay. The issue is that nobody in the mainstream media or like fitness instructors, I mean, not nobody, but like most of them aren't talking about releasing the pelvic floor afterwards. And so just like you are stretching muscles or foam rolling muscles or, doing things to counter out and balance your strengthening, that needs to happen for the pelvic floor too. You don't like run a marathon and then don't stretch, right? Or you don't like go to the gym for an hour and then don't get on the foam roller or don't stretch or do something. I mean, the same thing for the pelvic floor. The muscles have to be functional in their entire range, which means they have to be able to contract all the way and be nice and strong and symmetrical and coming in the way that they should with the abdomen. And then they have to be able to relax all the way back to baseline. And so oftentimes there's like a disconnect around that bell curve. Either they're staying tight and they don't come down, or they don't come up at all because they're too, weak or lengthened, or there's trauma, or they're not doing what they should be doing. They're not coordinating the way that they should. So we're not seeing, the benefits of strengthening the way that we should. So, there's been studies out there that show that women who are just verbally instructed how to do Kegels do them incorrectly. And I see that like 90% of the time in my clinic. I mean, like, we don't know how to do these correctly. And I think it's hard to know unless somebody helps you figure it out. I mean, there's no shame in that. Like, I didn't know until I like went to a course and somebody put their finger in my vagina and was like, this is how you do it. I'm like, oh. And then also this notion of like this cookie cutter approach, like everybody should be doing, like 40 a day. Like, as a PT, we don't blindly prescribe exercise without assessing, right? So like, I wouldn't just look at someone, or say like, if you have shoulder pain, you have to do like this exercise for this amount of time, this many times a day. Like you assess and you figure out what their baseline is and how they're moving and what muscles are coming in. And the same principles apply for the pelvic floor for muscle physiology and strengthening. So like, what I prescribe for one woman is going to be totally different than what I prescribe for somebody else because their pelvic floors are going to be functioning differently. So like the Kegel being like, oh, everybody should do 50 a day is like not appropriate and not applicable to everybody.
Yeah.
Whether you're having dysfunction or not, it's just like where your body is and what your baseline is.
Yeah, that makes sense.
Such a really good point and good clarification. All the magazines are they're like 40 times a day. I remember in college, my roommate's mom clipped like a magazine article, sent it in the mail, and like she hung it on our fridge, and she was like dedicated to doing Kegels like every day.
Yeah, and then like that's where we start to see problems because like people aren't doing the pelvic floor, but they're like squeezing their butt, and then they're like, "Oh, I can't poop," and I'm like, "Yeah, your glutes and your rectum, like your anal sphincter, is like holding on for dear life because you've been like squeezing 100 times a day, not relaxing." It's like, but I can't. It's like that's it's just what happens, and that's fine. Like we will help you and figure it out, but like. I just don't want women to feel like they need to be doing these types of exercises all the time, like, for what benefit?
Yeah. Thank you. That's a really good point. Well, that brings us into this amazing free gift you have because you're going to help people and you share how this is going to be helpful.
Yes. So I need to like think about that for a second. So I'm going to make a handout for y'all that is basically like the pelvic floor PT's like top 5 exercises for the pelvic floor. And so it's going to be, I'm going to add in some like very basic kind of pelvic floor activation exercises. No parameters though. I'm not going to say like 40 a day. I'm just going to say like, this is maybe what you should think about when you are like trying to figure out how to get your pelvic floor. So we'll do like a couple of those. And then I'm going to add in like 2 really good stretching exercises for the pelvic floor muscles that you can do to complement any sort of core work or strengthening that you're doing. So we are making sure that the pelvic floor is getting down to its good resting position afterwards and not staying contracted.
Nice. I love it. That's fantastic. So guys listening, grab it. The link is around our heads here somewhere. Grab that download and, let us know how it goes.
Yeah.
And if people are looking for someone like you wherever they live, is there a directory? Like, is there? Okay.
Yeah. There are. I can send you the links for those. But yeah, you can Google, good old Google. And then the American Physical Therapy Association has a Find a PT resource. So if you go to like apta.org, you can type in your zip code and look for specialty. And then there's another company out there called Herman and Wallace Institute. They're like a continuing education company for pelvic floor PTs, and they focus mainly on pelvic rehab. And they have a list of like PTs nationally that are pelvic floor PTs, and you can look up look there too.
Perfect.
And on Instagram and social media, there's some of us out there too, and we can help you guide.
Yeah, and you have a really good social media presence because you bring humor to this. So it feels more organic. It feels more natural to have that conversation. So
yeah, I've been loving your Instagram.
Oh, thank you.
Oh yeah.
Yeah, thank you. I'm glad it's like helpful.
It definitely is, because it's one of those things that we never really talked about. So let's start the conversation, and thank you for being here and starting that conversation with us.
Yeah, thank you. I loved it. I will, like I said, I will talk shop anytime.
Well, thank you so much for joining us. Thank you everyone for watching and listening, and grab your free gift. Don't forget, it's amazing. And I can't wait to see everybody in the next interview.
All right. Bye, everyone.
Bye, guys.
Bye. Thank you.